Hey, Sonrise Church family, we just want you to know that Grace and I, the staff, the elders, the leaders of the church, we are praying for you, and I want to bring you an update on behalf of the church about COVID-19 and things that have been going on lately. And it's my guess that COVID-related issues and concerns are coming up multiple times a day in most conversations, and different ways that people are feeling about it. And you may have heard that recently I just overcame COVID. Grace is pretty much mended and on her way past it now, Pastor Grace. And Pastor Kevin and I were symptomatic at the same time, and it feels like maybe some people got exposed at the same time. It's hard to trace for sure who got it on what day and from whom they got it, but we definitely had an uptick of COVID cases recently, and we do know that COVID is spreading just as the flu season is here, that those numbers are increasing. And so I want to just give a clarity update on our policies and let you know what we're doing as a church to try to keep things as safe and comfortable for people as we can. And so the leadership of this church, really labors seriously over the consequences of this pandemic that is brought to our doorstep and to the lives of people who come into our church that we're called to pastor and people that we are called to reach as well. Our concerns extend to how families and lives are impacted by what we do here. We are most aware of our responsibility over the space that we prepare. And of course, we cannot, with good conscience before the Lord, not address and provide crystal clear communication and direction. And I'd like to ask you to consider these safety guidelines in light of our church staff who is here laboring daily and putting themselves in front of a lot of people who have different health risks and needs and challenges. As I said, Pastor Kevin came down with it recently, and he just got out of the hospital not too long ago. And the doctor said that people with his x-rays for his lungs, they were dying. People that had that kind of level of symptoms. We have other staff members that are also family members in the hospital right now. And so I'm not just asking about your opinion or the data or the research, but to think of the people that are in our church that come here, that are visiting, that are on our team, that we want to care for one another in any reasonable ways that we can. And so each week our staff is sanitizing, preparing, praying over a clean space for you to come together to worship the Lord. And I want you to be aware of and respect the work that goes into the preparation that our team makes. The staff work very hard before you arrive and while you are here so that you may worship distraction-free. All of our staff wears masks during the week while they are in the building, unless they're alone in their offices, and we've doubled down and making that clear for our team what we're doing during the week as well to keep things safe. And out of an abundance of caution, we are asking our church to abide by the directive of the CDC, and as a result, it's our duty of leadership in the church to first off, monitor the size of our gatherings at 25% or about 200 people, which we're doing a good job of hitting right around there each week. We are socially distancing whenever possible with signs posted and verbal reminders, and people are doing a good job of this for the most part. Wearing masks at all of our gatherings, unless you're not medically able to do so. Say we're not doing as good of a job here as we could. I definitely seen an increase lately of people wearing masks, but we could improve as a church family of wearing masks. And I know it's hard to say with all the science and all the different theories and philosophies out there how effective or not these will be, but it is something reasonably that we can do and that we have chosen to do as a church, and we're asking all of you to do to help care for one another, or at least help protect one another's consciences depending on where people are at as they are coming in. And we're requiring all staff and volunteers to mask up during all gatherings and groups whenever they are in the building. And so the first and foremost here is the most important practical thing you could do, even more than wearing a mask, is if you don't feel well, stay home. If you have any symptoms, not just all the, most people aren't getting all the COVID symptoms when they come down with this virus, right? So if you have just a couple of the symptoms, stay home. If you get a positive test and you don't feel that sick, don't come back early around the public into one of our church services if you're on day 5 after a positive COVID test. Wait till you're done with your 10-day or 14-day quarantine that your doctor talks with you about, right? So we're asking you to put others first. And that's what we've been talking about out of Romans 14. I've been talking to you as a church about let's not move in fear. None of this is to try to communicate fear or panic. We have not been given a spirit of fear, but of power, love, and a sound mind. But we are called, according to Romans 14, to consider somebody else's conscience, to consider where one person might feel strong, another person might feel weak. And that's where we even lay down our own personal preferences and freedoms, is to care for the heart of what somebody else is dealing with in their life and what they're going through. So that's what I'm asking you to do as a church, and on behalf of our elders and leadership team, may God bless you. We're praying for you. If you have any questions or concerns, please contact us, and we will do our best to support you through this time and to support one another to the glory of Jesus. Amen. Amen. Thank you very much, and I hope that you have a blessed day.